Hey y'all, if this is your first time meeting me, hi, I'm Stacy. I'm a paramedic and paramedic instructor, and today I wanted to branch off of something that we talked about a couple of weeks ago, which was vitamins in EMS. Yes, we actually carry vitamins in our medication bag to treat emergency situations, but we also carry electrolytes. And if you're not EMS affiliated, whenever you hear about electrolytes, you might think Pedialyte or Gatorade or some kind of electrolyte replacement drink. And that's not wrong, but electrolytes are so important for just pH level, neurological function, cardiac function, everything in the body. Okay, if there's some kind of imbalance with electrolytes, it's going to affect you and it can be very, very serious. So let's talk about what we carry on the ambulance and what we use it for. Okay, let's start off with calcium chloride and calcium gluconate. Both of those can be used to treat beta blocker and calcium channel blocker overdoses, and they can also treat magnesium overdoses in the EMS field. And next, sodium bicarbonate. Sodium bicarbonate has multiple uses. It can be used for tricyclic antidepressant or aspirin overdoses. It can be used for metabolic acidosis, long downtime and cardiac arrest. There's even some use of it in the pre-hospital setting for traumatic brain injuries. And it can also be used to hyperkalemia or crush, compartment syndrome. It really can treat so many things. Let's move on to magnesium. We can actually use magnesium for a variety of things as well. We can use it for torsades, which is just a polymorphic VTAC. It's a deadly, lethal cardiac rhythm. We can use it for eclampsia, specifically eclamptic seizures, as an anticonvulsant. And we can also use it for respiratory distress, like acute asthma that's refractory to other treatments. And potassium. You don't usually see this in the 911 EMS setting, but in the interfacility world, you might see it for hypokalemia on some type of pump that's monitored. And normal saline, which is made up of sodium and chloride. It's pretty standard in EMS. We use it for dehydration, freshwater drowning, heat stroke, heat exhaustion, fluid replacement, and even just to keep a line open. And then there's lactated ringers, and lactated ringers alone isn't an electrolyte. It's actually made up of multiple. I believe there's calcium, sodium, potassium, etc. in lactated ringers, and it's given for hypovolemia, really good for burns and fluid replacement, dehydration sort of things. So if there are any other indications that these electrolytes have in the EMS field, I'm so interested. Leave them down below. I'm interested in hearing what you guys have seen them used for. So thanks so much for watching, and I'll see you next time.